This is Talk Business and Politics with Roby Brock.
Welcome to today's Talk Business and Politics Daily. I'm Roby Brock. Glad to have you with us. We are joined by Arkansas Foundation for Medical Care CEO Ray Hanley and Dr. Nate Smith with the Arkansas Department of Health. He's the director over there to talk about Arkansas's improvement in some health rankings. We should celebrate that we have improved our rankings, but we are still not anywhere near where we want to be.
Correct.
Who wants to tell me first of where we've moved and why you think we've moved from 48th to 46th in these latest Health Foundation rankings?
Ray, do you want to start with that?
Yeah, just with the caveat, I've spent a career trying to improve healthcare and access, and we've done really well on the access. Help stand up our kids first, help lobby to get the AR Works passed, so access, we've done well. But then these rankings come out, and we're 46th. Even though we have improvements, other states improved a little more. And I recently joined Dr. Smith on the Healthy Arkansas board and had a conversation about these rankings. But the good news is we are doing some things that are going to make a difference, and particularly want to hear from Dr. Smith on that.
Yeah, did we do better than some other states, or did some other states do worse than us? Is that sometimes how you move up in rankings?
Well, these rankings are very, very complex. They have a lot of different data sets, a lot of different parameters they look at. I tend to look less at how we're doing compared to other states and how we're doing compared to where we were, and maybe more importantly, what we're doing to improve things. I think it's definitely a positive thing that we went from 48 to 46. We're going in the right direction. In some cases, that's improving on our part. In some cases, we're holding our own, and others are getting worse. I think overall, we're seeing positive trends. One of the big ones is obesity. We actually held our own while the rest of the country continued to get worse. And so,
why do you think that is? What do you think contributed to obesity improvements there? I think it was about a 2% decrease in the number of Arkansans that fit that category in 1 year's time. That's a pretty dramatic move for 1 year.
It is a little difficult to comment on numbers from 1 year to the next because there's a little bit of a statistical noise, but we've had a lot of efforts to try and help Arkansans learn about healthy nutrition and getting moving, becoming physically active, and we're getting good response. Our Healthy Active Arkansas framework, which is public-private, broad-based cooperative initiative, I think has gotten a lot of people thinking about nutrition and physical activity in ways that they haven't been challenged to before.
Tell me a little bit more about Healthy Active Arkansas. You guys both are part of that. What exactly, it's a public-private partnership, as you mentioned. Right. What does it all involve?
Well, one classic case recently discussed the obesity issue with kids and school kids and nutrition in schools. And we've had a long conversation about how to reach out to school superintendents and on the nutritional aspects, because some of the regulations recently changed to remove some of the restrictions on fats and sugars in school lunches, which is going the wrong way. And so we're talking about how to reach educators and school principals and superintendents for one.
It goes beyond education though too, so tell me a little bit more about how, is it something that somebody has to engage in? Is it something that you guys are proactively going out and pulling people into participation?
It's some of both, Roby. The Healthy Active Arkansas framework has got 9 different focus areas, and it's very broad, ranging from built environment like complete streets to promoting breastfeeding. So there's something there for anyone. And there have been folks who hear about some aspect of it, and they decide to come in under one of the focus groups. And then we go after folks as well too, because there's some partners who are very important, like the business community, who don't normally think of themselves as being actively engaged in health issues.
Pulling those employers in on some things like that. I know there's also been some big community efforts to get involved. I think of Harrison, for instance, as one of the early adopters of a healthy community up there. Are we seeing more from the community perspective of that?
And not just Harrison, which is not that much of a surprise, but places like Lake Village, the Mayor Bush down there really engaged the community in a healthy lifestyle with a community center there. We've produced a video for them on that they're using to apply for grants. So there are some bright spots around the state, and some you might not expect, including in the Delta.
You mentioned Arkansas Works in our introduction remarks here, but talk about some other policy efforts that you think have been making a big difference in Arkansas, more from the big picture perspective. There's a lot of little things we could talk about, but what do you think have been some big moving parts that have helped make a change in some of these overall health rankings?
Well, a lot of the work is at the community level, and we have some very strong partners like RCOP, who's been working with communities, because I think that's where a lot of the action happens in terms of...
What was that acronym again?
RCOP, Arkansas Obesity Cooperative.
Gotcha, okay.
Anyhow, they go by RCOP these days.
I gotcha.
And but they've been working with communities and in terms of making better access to healthy foods, community gardens, and walking trails, and have done some great work with mayors, their mayor-to-mayor mentoring program. So that's where a lot of the action really does occur. In terms of big policy issues, that's something where there's a lot of potential as well. And last year, the legislature had a proclamation basically talking about the importance of health and health in all policies. And
they've even done some things over the legislature to try to improve their own personal health up there. I think they've got a STEPS program and some other things.
The Capital Go is sponsored by Healthy Active Arkansas, and they've really shown a lot of leadership. Last year, some of our legislators really did an amazing job.
The best legislators are the ones with the most miles on them,
That's right.
Could you imagine Jody Mahoney back in the day?
With his cardboard box
with
under
the
his
cardboard
arm.
box and
Yeah.
all the steps that he would have had in there. That would have been good. Let's talk about one of the statistics that we have not seen tremendous improvement in, and that is smoking in Arkansas. There was a new study out by the Arkansas Center for Health Improvement that showed the cost to the Medicaid program, I believe $795 million annually related to smokers in Arkansas.
Which is a lot more than the tobacco tax and settlement generates, so Arkansas loses on that.
There has been some conversation about raising the tobacco tax here, but it's a high threshold. It wasn't part of the omnibus tax reform bill. It makes it kind of difficult to do that. What is our approach to curtail smoking in Arkansas at this point in time?
Actually, we have made a fair amount of progress with smoking. If you look at adult smoking rates, they have steadily decreased, and we've made more progress with our youth smoking. Over the last 15 years or so, they've fallen by about 50%. But we've got a long way to go, and in terms of other states, we're still much higher, both in youth and adult smoking. And smoking is a driver for cancer and for cardiovascular disease, which are our leading causes of death and a cause of untold illness in our state. And so this is something that we really could do a lot better in.
Yeah.
Now the Arkansas Department of Health has our Be Well program, which is has replaced our tobacco quit line. The number still goes to Be Well, but it now provides more comprehensive cessation services and also services for managing chronic diseases like hypertension and diabetes. And so for those who are already smokers, there are some real resources there in our state to help. The big thing though is to help people not smoke in the first place. And we've got a pretty comprehensive network of local organizations working with youth, but one of the big challenges has been the e-cigarettes and the vaping.
Let me circle back to that real quick, but to go back to something Dr. Smith said earlier about over the last 15 years we've seen some progress. You could trace that almost specifically back to the tobacco settlement funds,
You could,
can't
where
you?
both parties came together to dedicate all the tobacco settlement money to cessation, which was Governor Huckabee's leadership, but a lot of legislative stalwarts. But the numbers are still ugly. The last 40% of the people in this state still, 40% of the Medicaid population smokes, about 25% of the general population. And you know, I'm reminded of something somebody said, you know, cigarettes are the only legal product that when used as directed by the manufacturer, set it on fire and inhale, causes death and disease. So the tobacco cartel is really powerful. They've still spent a lot of money lobbying, and it remains a really big challenge.
Yeah,
but we are working on it.
There is that push to tax, put a tobacco tax on e-cigarettes and vaping in the session. Again, it comes back to the fact that it is a very high threshold that was set years ago that it would cost, you know, I mean, you have to get 75%
Yes.
of the votes in both chambers.
It
We've
does
seen the
sell.
tobacco tax pass before, though. Remember in Mike Beebe's first term as governor, he did that. Do you think there's any will out there among the legislators to do this?
I'm not sure I can read the tea leaves on that. If I could, then I'd probably be doing a lot better for
You'd
myself.
probably be sitting in my seat and be a political
That's
pundit
right,
is what
that's
you'd
right.
be, so.
Just to jump on to what Ray said, though, tobacco, including the new generation of nicotine products, the vaping and e-cigarettes, really are unique in our market. Tobacco causes 1 out of 3 cancer deaths in our state, and when used as directed, tobacco kills 1 out of every 3 long-term users. And so we really don't have anything that's for sale that is like that. And so treating it differently is probably appropriate.
Yeah, I've lost 2 grandparents early in their lives to lung cancer.
I lost
back in
both
the
my
day,
parents
so.
to tobacco-induced cancer, and it's ugly close up.
I'm gonna let you guys wrap up. I'm gonna give you a chance to plug one website that you would like to plug. That if people watching this want to go somewhere for some more information, where would you steer them?
Well, Healthy Active Arkansas is a great website. If you go to the Arkansas Department of Health website, you can find a lot of good information. We haven't had time to talk about suicide prevention or opioid prevention, but those are really important in our state as well, and you can find information at the Arkansas Department of Health website.
All right, you come back and talk about those with us? All right, you too?
Absolutely.
Maybe. All right, you get one website too.
Well, the Arkansas Foundation for Medical Care site will lead you to tools on diabetes education and a lot of things. So it's well worth looking
There's
at.
basically no excuse for someone to not get online and try to find something to make their lives a little bit healthier.
Not at all.
Agreed.
All right, Dr. Smith, Ray Hanley, thank you very much.
Thank
Appreciate
you.
both.
Thank you.
That's all for today's Talk Business and Politics. I'm Roby Brock. Thanks for tuning in. We'll see you next time.
Each day, the promise of our nation begins again. Arkansas and America, moving forward. I help make that promise a reality. It's not for everyone, but people everywhere depend on us.
Oh, I love you too, sweetie.
Trucking delivers, or everything stops. And that's what drives me.
I did.
You'll find us at the end of a lot of long country roads, covering over 60% of the great state of Arkansas. Our 17 electric distribution cooperatives are working day and night to provide reliable, affordable power to over 500,000 homes, farms, and businesses, just like yours. The Electric Cooperatives of Arkansas, your local energy partners.